Okay, for those that are watching this taping, we are joined again by Mellany Murgor from our Kenyan chapter of the Young Professionals Chronic Disease Network. We were fortunate enough to have Mellany join us for our YP Speak session on Wednesday, February 4th, marking World Cancer Day. And she has graciously offered to re-record the information, the beautiful information that she presented again with us so that we could share it with all of you. So to reiterate for those that will be watching, Mellany is a young doctor from Kenya. She serves as the country representative for the Young Professionals Chronic Disease Network there. She's also a volunteer member and research associate of Happy Kidneys Foundation in Kenya, as well as the Africa Orthopedic Research Foundation. She's affiliated with the Africa Cancer Foundation as well as in her role as a volunteer member. So in her capacity with YP-CDN, she has been able to organize monthly meetings with members discussing various topics, including tobacco, trade and policies, as well as medications in relation to NCDs. She has a strong interest in global health with main focus on non-communicable diseases, reproductive health, and cancers affecting women. She has been actively involved in breast and cervical cancer screenings as well as education for young girls and women in Kenya, so across the country. So I will pass the mic over to Mellany as she leads us in her presentation. And for those of you that will be watching, again, feel free to follow up with questions or discussion questions on ypchronic.org, so our blog there, as well as on Twitter. So Mellany, please go ahead.
Okay, thank you so much. Thank you so much for the introduction, and hello to everyone. I'm going to present to you what YP-CDN has been doing in Kenya, and just give you an overview of what we've been up to and what we'll be doing for the next few years to come by.
Perfect. Okay. So I'll get your slideshow started or your PowerPoint started for you, Mellany. And there you are.
Okay. So YP-CDN in Kenya started about 3 years ago. It was started along with one of the major founders who was called Duncan Matheka. He founded it at around just before the meeting, during the UN high-level meeting, discussion on NCDs. So Dr. Duncan Matheka started this initiative in Kenya after attending the meeting, and also was joined by I and Joseph Nderitu. We started initially as 3 members, but the membership has grown tremendously to about more than 40 active members currently in Nairobi, and we are hoping to expand it all over Kenya. It has a vibrant, growing membership comprising mostly of medical students from the University of Nairobi, but it is still growing to the other medical schools in the country. Most of our members have been involved in research work, in advocacy. We meet every 3rd Thursday of the month to discuss very vibrant issues. And as you can see on this slide, we have, on the far left, we have Dr. Duncan Matheka, who was making a presentation there on one of his research work. On the far right, we have Joseph Nderitu, who is currently a final year medical student at the University of Nairobi, who was presenting his work during the AMSON conference, which is the Association of Medical Students, University of Nairobi. And then on the lower right, we have one of the members discussing issues on one of the discussions about Ebola. This is just a sneak preview of the members that we have, and there are so many other vibrant members, the rest who are doing very much amazing work. In addition to that, we are involved in community NCD awareness. As you can see in this PowerPoint presentation, in this slide, you can see these are some of our members being involved in a medical camp. Most of the time we participate in the medical camps in association with other organizations. We help them in NCD advocacy, and sometimes because we are comprised of medical students and young doctors, we help with the consultations. In addition to that, we have one of our major projects, which is the rheumatic heart disease project. This is a project by Dr. Duncan Matheka. He's been very vibrant about the rheumatic heart disease. Rheumatic heart disease is a condition which is caused by untreated streptococcal throat infection, and this leads to the valves of the heart being affected, which may eventually lead to heart failure and maybe even death. This is a condition which is really prevalent in Kenya, especially in the slum areas and in some of the highland areas in Kenya. It has affected a majority of young children, and yet it is a very preventable disease. So Dr. Duncan Matheka, using a module from Wired International, taught young primary school going children about rheumatic heart disease, basically about hand washing, covering their mouth when coughing, and seeking medical treatment when they have a streptococcal infection. In addition to that, after the training, he helped establish the Rheumatic Heart Disease Support Club for the patients and families. This is a club which has been running for about 1 year right now. The members meet at least once a year to discuss various issues and to see how they can help each other moving forward. This is also in partnership with Clan Australia, who've been very vibrant and supportive with the establishment of the Rheumatic Heart Disease Support Club, which is very fantastic. In addition to that, the other project that we've been doing is on awareness of Ebola. As you know, Ebola is one of the emerging current issues in the world, especially in West Africa, where it has claimed the lives of so many people. This is a training that we did to emphasize and to sensitize the members of our club and also members from the school about Ebola. Basically trained about the health systems on Ebola, trained about the sequence, all the signs and symptoms, how to identify the personal protective equipment and on, and how to take care of themselves, because Kenya is a country in Africa and Ebola could reach here. So it would be great if our members were not only taking care of the non-communicable diseases, but also learned about the emerging communicable diseases that could affect all of us. In addition to that, one of the major projects that we carried out last year was on Relay for Life 2014. Relay for Life is an initiative by the American Cancer Society, and last year it was adopted by the Kenya Cancer Association in Kenya to help raise funds. It was preceded by a dinner. The inauguration was preceded by a dinner at Serena Hotel. Thereafter, there was a training of the members at the Aga Khan Hospital, and thereafter, members participated in the Relay for Life event, which was a 24-hour event. So the members were trained on the importance of Relay for Life, the objectives of Relay for Life, and how to fundraise for the Relay for Life. The main objective was to get about 300 million Kenya shillings to help treat about 20 adults with cancer and also about 10 pediatric patients with cancer. And this was one of the things that we learned to do: teamwork, resilience, working together, and supporting each other. Just seeing the survivors during the Relay for Life is one thing that really motivated us to continue doing this initiative. And I'm sure our members are very excited about 2015, and they will definitely participate in Relay for Life 2015. On the other hand, as we were fundraising for this Relay for Life, one of the major cancers that was of note is cervical cancer. Cervical cancer is a cancer that affects women in Kenya. It is ranked as the first cause of female cancer deaths in Kenya and the leading cause of deaths in women aged 15 to 44 years in Kenya. It is 6 times more prevalent in Kenya than it is in Western Europe. All this is according to the statistics estimates by WHO 2012. As you can see, this is quite a scourge in Kenya, and cervical cancer is one of those cancers that can easily be prevented, and if detected early, can be treated with very good prognosis. So this is one of the topics that I'm very passionate about, having met so many women with cervical cancer. So I decided to carry out a mobile phone-based survey to find out what exactly do women in Kenya know about cervical cancer and HPV vaccination in Kenya. So this survey, I created it using a platform called M-Survey, which is an mHealth platform. You create the questions and then you send it out to respondents and they give you the feedback. You get the feedback on a spreadsheet form, ready to be analyzed, and you create the charts, infographics, and all. So these are some of the questions, about 8 of them, which I sent out and analyzed. And the results were as follows. As you can see in this infographic, which is a ribbon of with the teal color representing cervical cancer, we had about 30% respondents being male and 70% being female. We're asking them if they knew about cervical cancer, the causes, and what were their sources of information. Most of them said they knew the cause being sex and other STIs. Only 28% could correctly identify the human papilloma virus, while the rest said the general causes of cancer like genetics, alcohol, tobacco, bad eating habits, while 8% totally had no idea what causes cervical cancer. When asked about their source of information, 30% said they got it from healthcare personnel. That could be a doctor, a nurse, or anyone from the healthcare sector, including a pharmacist, dentist, whoever knew about cervical cancer. About 26% said they got from word of mouth, which is a nurse, where they mean family, friends, and all. 20% said they got from televised media, print media, while 5% used social media. As you can see, a majority of the respondents were aged 17 to 25. And of note is they use social media a lot of Facebook and Twitter and all, and blogs. But of note is they don't use this to get their knowledge on cervical cancer. When asked about the HPV vaccination, which was another component of my study, asked if they were aware that there's a vaccine for HPV, only 60% were aware, which is quite a good number, while 40% totally had no idea. When asked about the age groups, those who said 9 to 13, about 30%, 14 to 18, about 28%, 19 to 26, about 30%, and the rest 10%. As you can see, the correct age group, which is currently recommended, is about 9 to 13, which is had a low, very few people knew, about 30%. This is of note that we need to increase the awareness of the HPV vaccination and the correct age group so that these people can present for vaccination. When we asked about the vaccine targets, a majority said females should be vaccinated. Very few had been vaccinated or knew anyone had been vaccinated, but a majority, about 90%, were willing to be vaccinated or would recommend anyone for vaccination. So definitely from this study, to deduce that there was low information on cervical cancer and HPV vaccination, which should be increased for people to have increased uptake about the HPV vaccination. And if they know more about cervical cancer, they're able to take charge of their life, go for screening. This basically just shows the same results that as I have discussed. Okay, so this is during the World Cancer Congress. I was able to present my findings on the research. And during this World Cancer Congress, I was also able to attend the World Cancer Leaders Summit, which the main discussion was putting an economic case for cancer control. And as you can see, one of the major cancers that is affecting low middle income countries is cervical cancer. And understanding the economics to go about it was such an important topic for me. And I can't wait to implement most of the things that I learned from there back at home. In addition to that, from the World Cancer Congress, after that, this is the new year. And as we progress forward, you can see one of the initiatives that we will continue to do. This is a charity work for cervical cancer survivors. This is a work we carried out to fundraise, get more money to help the cervical cancer patients and those who had already were free of cancer to continue living their life and to continue getting support. for themselves so that they can fend for their lives better. And finally, the World Cancer Day was here. And we're telling everyone in the world, all the women in Kenya, those who have cervical cancer, not those who've been affected or infected, or those who've been affected or infected, we're telling them this is World Cancer Day, and cancer is not beyond us. We can fight this. And currently, during this weekend for the World Cancer Day, I'll be participating in a cervical cancer and breast cancer screening in Nairobi, which has been organized by Africa Cancer Foundation and its partners. So this is just one of the initiatives I'll be participating in, but we are looking forward to kicking cervical cancer out of Kenya, out of Africa, and out of the world. Thank you.
Thank you very much, Mellany. That was a great presentation. So I thank you for taking the time to join us.